Welcome back to Why We Nurse. I'm your host, Serena Tobar. Today's episode is part of Podcastathon, a global initiative bringing podcasters together to support causes that matter. This year, Why We Nurse is supporting the American Heart Association, whose mission is to save lives and improve heart health across communities. This episode is about awareness, preparation, and empowerment, because heart health touches every family. Heart disease remains the leading cause of death in the United States. But what's important to know is that early recognition and early action saves lives. The American Heart Association emphasizes prevention, education, and rapid response. And as nurses, we see the difference those seconds make. As nurses, we don't just care for diagnoses, we see patterns. We see patients who ignored symptoms because they didn't seem serious enough. We see families who say, "We didn't know that was a warning sign." And we see how quickly outcomes change when action is delayed. This is why education matters as much as treatment. I want to pause here for something the American Heart Association emphasizes strongly. Knowing the signs saves lives. Heart emergencies don't always look dramatic, and that's part of the danger. Heart attack warning signs can include chest discomfort, which is pressure, squeezing, fullness, or pain, discomfort in the arms, back, neck, jaw, or stomach, shortness of breath, nausea, lightheadedness, or cold sweats. And symptoms may look different in women, often more subtle, like fatigue, nausea, or jaw pain. Cardiac arrest, on the other hand, is sudden. It often looks like sudden collapse, no pulse, no breathing, and a loss of consciousness. And stroke warning signs can be remembered with FAST: face drooping, arm weakness, speech difficulty, and time to call 911.
My name is Gracie Dorn, and I had a stroke when I was 10 years old. Knowing how these stroke warning signs may look, sound, or feel can help save somebody's life, maybe even yours. Remember the word FAST, F-A-S-T, to recognize the most common warning signs of stroke. F for face drooping, A for arm weakness, S for speech difficulty, and T for it's time to call 911. Learn how to save a life from.
The key message here is simple. If something feels wrong, act. Waiting costs time, and time costs heart muscle and brain function. Speaking from my role as a CPR instructor, I want to share this from an evidence-based standpoint, not promotion. Early CPR, especially by a bystander, can double or even triple survival rates during cardiac arrest.
The first step is to ask someone to call 911 and to get an AED, or call 911 yourself and put your phone on speaker mode so the operator can assist you. Then get directly over the victim. Put the heel of one hand in the center of the chest and put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Staying Alive, or the rate of music you're listening to right now. Let's hope you never have to use hands-only CPR. But know that CPR combined with using an AED provides the best chance of saving a life.
The American Heart Association has shown us that cardiac emergencies most often happen outside of hospitals, at home, at work, or in public. The first responder is usually not a professional. It's a family member, a friend, or a bystander. Knowing what to do and being diligent and willing to act changes outcomes. Heart health doesn't begin in an emergency department. It begins with prevention, access, and education. The AHA's focus on equity matters deeply because where someone lives or the resources that they have should not determine whether they survive a cardiac event. As nurses and educators, our role extends beyond intervention. We help build informed, prepared communities. This episode brings together so many parts of who I am as a nurse, caregiver, educator, and advocate. I've seen what happens when warning signs are missed. And I've seen what happens when someone knew what to do and did it. That's why heart health matters to me. If you take one thing from today's episode, let it be this: know the signs, act early, take heart health seriously, yours and those around you. Supporting organizations like the American Heart Association helps advance research, education, and systems that save lives every day. Thank you for listening to this special podcast-on episode of Why We Nurse. Follow at Why We Nurse on Instagram for more conversations that matter. Until next time, stay informed, stay prepared, and remember why you nurse.